Hello everyone, this is Dr. Bidisha working as consultant pediatric intensivist and neonatologist at Virinchi Hospital, Banjara Hills. So throughout this week we are celebrating World Breastfeeding Week. The theme of this year is Step Up for Breastfeeding, Educate and Support. So throughout this week we have discussed a lot about breastfeeding and almost we have reached at the end. So at the end, I would like to request all of my viewers to do inclusive breastfeeding, to be inclusive in breastfeeding. See, breast milk is the best nutrition for the newborn. This is a fact and universally accepted. But having said that, if for some medical condition or unfavorable situation, if you have failed to do proper breastfeeding, or you have found someone in your family or friends who couldn't do proper breastfeeding, that's okay. Don't criticize her or don't feel yourself guilty. See, a mother wants to give the best to her kid. That's what matters. And a baby doesn't need mother only for breastfeeding for first few months of his or her life, right? A baby needs her mother throughout his or her childhood for proper mental and physical development. And for that, a happy, content and confident mother is required. Feeling yourself guilty or making someone feel guilty for not doing proper breastfeeding doesn't serve that purpose. Also, there are many parents who are not biologic parents. They have adopted a baby. There are many single father. There are many transgender parents are there. Cisgender parents are there. Non-binary parents are there, who all are working and trying their best as a parent to give best to their kid. Sometimes it is not possible for them to lactate and to give breast milk to their baby. They are using maybe donor's breast milk or formula milk, and that's absolutely okay. Don't criticize or don't feel yourself guilty or don't make someone feel guilty. Also, there are some terms often used which is called chest feeding or body feeding, where a parent who cannot lactate makes the baby to suck on his or her nipple. That helps in foster attachment, emotional bonding, helps to improve the suckling reflex of the baby, also helps in pain relief. Okay, so this is also called non-nutritional sucking. That helps in the teeth alignment of their baby also. So everything is important and everyone is trying their best for their babies. Also, there is a term that is supplemental feeding at breast, where the parents who cannot lactate or who have failed to lactation, they feed their baby with a tube attached to the nipple. The tube supplies either formula milk or donor's breast milk. So all these are okay, and let's be inclusive. Don't criticize anyone. Also, even today, standing in 2022, some mothers in our country, they feel uncomfortable to do breastfeeding in a public or in workplace for lack of proper infrastructure and security. So whatever possible within our reach, let's try to build up a breastfeeding room or breastfeeding corner in the public places, shopping mall or workplaces, where breastfeeding can be done in with some comfort and with some privacy. If you find any mother is breastfeeding in public, don't criticize her or don't stare at them. A mother is feeding her baby, that is absolutely normal. So with positive approach, with inclusive approach, only we can bring changes. So don't be the prey of social media pressure, and don't criticize anyone if they have failed to do breastfeeding. That's okay. Everyone is trying best for their baby, and that's what matters. Take care. Thank you.
Visit Virinchi Hospital for evidence-based treatment.